My name is Dr. Tara Harzma. I am an OBGYN, and I chose obstetrics and gynecology as a profession because I really enjoy women's health and I enjoy delivering babies. Every pregnant woman will have an idea of how their labor and delivery process should go. It's not a bad idea to have kind of a written birth plan or a birth plan in your mind, and it's important to speak to both your physician and your labor and delivery nurse and kind of let them know the things that you had planned or the things that you desire, and we try to stick to those as close to possible. As an OBGYN, we really recommend to have an open mind because things can change in a flash in labor and delivery. Our primary goal is, to have a healthy mom and a healthy baby. So no one can predict when labor will start. Your due date is merely a reference point to determine when baby is considered full term. Labor can begin anywhere from 3 weeks prior to your due date to up to 1 to 2 weeks after your due date. If you do end up going a week or two over your due date, your doctor may recommend an induction, and this is to help prevent any risks that can be associated with a post-dates pregnancy. There are 5 main signs of labor, and not every woman will experience every sign. The first one is called lightning, and this is when the fetal head will drop into the maternal pelvis. You may notice that your belly appears lower. It might be easier for you to breathe, and you'll probably notice an increased need to use the restroom, and this is due to the baby's head being so low in the pelvis. Another sign is what we call bloody show, and this is a red-tinged or brownish discharge that's coming from the cervix, and it may be mixed with your mucus plug, which is kind of a thick yellow mucus-type discharge that usually indicates that the cervix is starting the dilation and the softening process. Another sign would be diarrhea, so frequent loose stools usually means that delivery is imminent. Rupture of membranes, so this is when you experience a big gush of fluid, or you might notice continuous leaking of fluid, and this fluid is coming from the amniotic sac. The amniotic sac is that protective barrier of fluid that was surrounding the baby in pregnancy. Labor typically will occur within 24 hours of your water breaking. If labor does not start, then your doctor will talk to you about starting a medication to help get contractions and labor progressing so that we can decrease the risk of infection to both you and the baby. It can be hard to determine when you are in full labor. So if you are experiencing any symptoms that you're not certain about or you have questions about, you can always call your healthcare provider, or else you can always go to labor and delivery to be evaluated. If you present to labor and delivery and they end up sending you home in what we call false labor, we just recommend try not to be discouraged or embarrassed. It commonly occurs, and you can just be reassured that labor is on its way. So at some point, most mothers will experience contractions. So a contraction is the tightening and relaxing of your uterus, and this motion is going to help dilate the cervix and bring the baby through the birth canal. You may notice around the 3rd trimester of pregnancy, you have some tightening in your belly, which is called the Braxton Hicks contractions. Typically, these are not painful, and they occur infrequently. In the kind of pre-phase or early phase of labor, you may notice some painful contractions that are very irregular. Typically, these contractions are not causing cervical change or dilation, and it's just kind of the body preparing to go into full labor. Labor contractions are considered when you have painful contractions that sometimes start from the back and radiate around to the front. And they occur usually every 3 to 5 minutes, and you've been having them consistently for an hour. That's a good sign that these contractions are actually making cervical change and labor is here. There are 3 stages of labor and an early stage of labor. The stage of labor is usually determined by how far dilated your cervix is. So the early stage, or kind of pre-phase of labor, is when your cervix is 0 centimeters to about 4 to 5 centimeters dilated. This stage, or phase, I guess, is usually associated with some irregular contractions as well as an increase in vaginal discharge. The first official stage of labor is called the active phase, And this is once your cervix is 5 to 6 centimeters dilated, and you're usually having regular, painful, predictable contractions. Your water may break or might be bulging, and typically you're making cervical change at a rate of 1.2 centimeters per hour to 1.5 centimeters per hour, depending on if it's your first baby or not. The second stage of labor is what we call the pushing stage or phase, and this is once your cervix has become 10 centimeters, or we call it complete, and the baby's head has dropped down into the pelvis. At an appropriate station, we will have you begin pushing. And for most moms, it can be anywhere from 5 to 10 minutes, or it can last up to a couple hours, depending on if you've had a baby or not before. The third stage of labor is delivery of the placenta. This will usually take about 5 to 10 minutes after delivery of the baby, but in some people it can take up to 30 minutes. After delivery of the baby, we like to do what we call skin to skin, and this is where we will place the infant on the maternal abdomen or chest, and this has been shown to improve maternal-infant bonding as well as help the baby transition to the outside world. Once the baby has been placed on the abdomen, we will clamp the cord, and then we will ask either the father or a support member with the mother to cut the cord. And then once the cord has been cut, this is when we will deliver the placenta and do any repairs necessary. At some point, the labor and delivery nurse will take the infant over to the warmer, where we will measure the baby and weigh the baby and make sure it's meeting all its milestones. So here in Brookings, we have 3 OBGYNs who manage both normal and high-risk pregnancies. We deliver babies that are over 35 weeks gestation. However, if there was that situation where a mother came in labor and it wasn't safe to transport her and she happened to be less than 35 weeks pregnant, you can be reassured that all of our staff, the labor and delivery staff, the anesthesia, as well as the OBGYN physicians are all certified and trained to manage neonatal resuscitation and preterm infants.